With me is Francis Pateros, and today we will be reporting about the nursing informatics in Canada. In order to have a visualization of our topic, I will give you an overview. So, Canadian healthcare systems have undergone tremendous change as a result of technology and communication influences that has consequently impacted nursing and nursing education. Objectives. So today, our main objective is to gain knowledge about the current status of the nursing informatics in Canada. So it is important to, first, provide the definition of nursing informatics in Canada, provide a historical overview of the development of nursing informatics in Canada, third, gain knowledge about the health informatics in Canada, and fourth, is to differentiate the current healthcare system of Canada to other countries. So just a review, the widely used definition of nursing informatics was defined by Graves and Corcoran in 1989. So it is defined as a combination of computer science, information science, and nursing science designed to assist in the management and processing of nursing data, information, and knowledge, to support the nursing practice and also the delivery of nursing care. While on the other hand, the definition of nursing informatics in Canada, so it is defined as a science and practice that integrates nursing and its information and knowledge with the management of information and communication technologies to promote the health of people, families, and communities worldwide. This was defined by the International Medical Informatics Association, which is a special interest group on nursing informatics. And the definition was then adopted by the Canadian Nursing Informatics Association, which is an association that has contributed a lot to the improvement of nursing informatics in Canada. This association will be discussed later.
Focuses of nursing informatics in Canada. First is the role of nursing within the healthcare organization. Second is a long-standing tradition that nurses have the role of custodian of information on behalf of other caregiver and users of patient information. In 1998, Canadian Nurses Association spearheaded the National Nursing Informatics Project. National Nursing Informatics Project. Each participating organization appointed a nurse, which is an expert in nursing informatics, to a 5-member working group to develop and initiate a plan to, first, develop a national consensus on definition, competencies, and educational strategies and priorities in information development. Second, is to identify curriculum implications and strategies for both basic and continuing nursing education. Third is to determine priorities for implementing national nursing informatics education strategies. In 1975, the establishment of Canadian Organization for the Advancement of Computers in Health, or also known as COACH, it has actively initiated professional protocols for using computer systems in Canadian healthcare. And also today, COACH is a leading organization with an evolving membership, and also the forefront of Canadian healthcare information resource and technology field. Canadian Nursing Informatics Association, or also known as CNIA, exists to help nurses across Canada to learn, share, and research and create informatics-related projects and experiences that can help to boost the competencies, theory, and practice of informatics on a national level. To be the voice of nursing informatics in Canada, the CNIA is the culmination of efforts to catalyze the emergence of new National Association of Nurse Informatics. Its goals is first to provide nursing leadership for the development of nursing health informatics in Canada. Second is to establish national networking opportunities for nurse informaticians. Third is to facilitate informatics educational opportunities for all nurses in Canada. Fourth is to engage in international nursing informatics initiatives. Fifth is to act as nursing advisory group in matters of nursing and health informatics. And lastly, to expand awareness of nursing informatics to all nurses and the healthcare community. Health informatics. Health informatics projects in Canada are implemented provincially, with different provinces creating different systems. Canadian Institute for Health Information. It is an independent pan-Canadian non-profit organization established by joint federal and provincial territorial ministers of health with a mandate. It also coordinates the development and maintenance of a comprehensive and integrated approach to health information for Canada. WILC Task Force presented comprehensive goals and a strong vision for a nationwide health information system. Canada Health Infoway Incorporated resulted in commitment in October 2000 by the federal government of $500 million to support the development and coordination of pan-Canadian health information systems necessary to achieve an EHR, or electronic health record. It is also incorporated in January 2000 and began its first year of operation in April 2001.
So the next part is the provincial and territorial programs. As what Patera said earlier, the programs or the improvements in the healthcare system in Canada is done by province. So I will present to you some examples of its many programs. First is the Alberta NetCare. This was created in 2003 by the government of Alberta. This provides access to demographic data, prescribe or dispense drugs, known allergies or intolerance, laboratory test results, diagnostic imaging reports, immunization, and other medical reports. Another example is the Canadian Nurses Portal Project, or commonly known as the Nurse One. Canadian leaders in nursing informatics formulated a nationwide nursing informatics strategy that would benefit all nurses and nursing students. The project addressed the vision through an electronic nursing strategy. So in order to achieve the goals of the key national organizations like the CNIA and Canada Health Infoway, they have implemented their major project, which is called the Canadian Health Outcomes for Better Information and Care Project, or what we call CHOBIC. This project supports the advancements and use of standardized patient assessment and related documentation. These assessments enable the provision of feedback to nurses about patient outcomes and the ability to compare outcome over time. CHOBIC is introducing structured evidence-based standardized questions for admission and discharge assessments. This is important to people receiving care within the healthcare system. So in CHOBIC, we have 4 different concepts, and the first one is functional status. An example of this is continence. The second concept are the symptoms like pain, fatigue, or dyspnea. And the third concept is safety. And some examples are falls and pressure ulcers. And the fourth CHOBIC concept is called the therapeutic self-care, like readiness for discharge. So these concepts are items that all nurses routinely assess in healthcare settings. So this information will be used to examine, practice, and improve health outcomes within settings and across the continuum of care. So the use of data standards allows for abstraction to relevant and secure databases in preparation for entry into provincial electronic health records. So just a trivia, did you know that the Canadian Nursing Informatics Association and the Canadian Nurses Foundation presented the new Canadian Nursing Informatics pin? This pin was conceptualized by CNIA to represent and celebrate nursing informatics in Canada. It is a stylized representation of Florence Nightingale's rose diagram. It was created in commemoration of the Nursing Informatics Day in coinciding with May 12, the birthday of founder of modern nursing, Florence Nightingale. So now we are already in the end part of our topic. For the conclusion, globally, the International Council of Nurses have goals of increasing the visibility of nursing contributions in healthcare, standardization of nursing data to support intersectoral comparability and analysis, as well as supporting evidence-based practice, and these were all highly aligned to the nursing goals in Canada. So just to wrap everything up, the key national organizations in Canada who are responsible for the improvements and awareness of nursing informatics in the country are the CNIA, the Canadian Institute for Health Information, the Canada Health Infoway, and the Canadian Nurses Association. So this has been Nicole Ong and Francis Pateros, your reporters for today. Thank you for listening.
Baby, baby, no